Hello friends, now we are starting with our next topic and the topic is prevention in pediatric and obstetric. This is again a very important topic from our examination point and around 4 to 5 questions are definitely going to ask from this topic. Number one is that how we define the maternal mortality ratio. It is defined as number of the maternal death per 1 lakh live births, okay, and if it is MMR is written, consider this as it is the maternal mortality ratio, okay, but if they are trying to ask as maternal mortality rate, then they will be writing as an maternal mortality rate, okay, and maternal mortality rate is number of the maternal death per 1 lakh reproductive female. So if they simply mention MMR, consider this as a ratio, but they ask as a maternal mortality rate, then it will be a maternal death per 1 lakh reproductive female. Otherwise MMR is in general as maternal deaths per 1 lakh of live births, okay, and this is considered as a ratio in general. Then next point is that which period are considered for the maternal death. So any death which is happening from the point of conception till 42 days after the delivery, means it is including the pregnancy period, antenatal, during the delivery natal and the postnatal period. So these are the periods included in calculation of the maternal deaths. The next point is what could be the reason. So any cause which is directly related to the pregnancy or it is aggravated by the pregnancy, like existing condition hai, it is aggravated in pregnancy, maybe an anemia, maybe an cardiac disease, rheumatic heart failure or rheumatic heart disease, liver diseases, kidney diseases, which if it has been aggravated because of the pregnancy, it will be considered, but it is not the accidental or incidental like a snake bite hai or dog bite hai, it will not be considered. And based on that, they can be asking us to calculate a small numerical. So numerical mein hamesha always we have to remember the 2 points. Number one, carefully calculate the maternal deaths excluding all accidental or incidental deaths. The second is that we should be going for 1 lakh live births. Okay, so see very carefully in the question, if they are trying to give you the total birth, they are trying to give you the stillbirths, they are trying to give you the live births. Okay, so total birth hai or stillbirth hai, so stillbirth the total births means you have to minus the stillbirth to get a total live births. If they had already given you the total live births, then take directly that total live births, don't take the population, and multiplying factor is per 1 lakh. Okay, so this is how you have to calculate the maternal mortality ratio. The most common cause of maternal mortality, it is hemorrhage, and that is the postpartum hemorrhage, because the postnatal period is most dangerous, and the most common indirect cause is anemia. Now as still some of the deliveries are happening in the periphery, the deaths are happening in the periphery. So to find the cause of the death in if it is happening in periphery, we are doing the verbal discussion with the relatives who are present at the time of the delivery, and this is what is called as verbal autopsy or rhyme method. Now current MMR value of India as per our September SRS 2025, it is 88. Okay, this is an updated value, it is 88, and goal is that as per the sustainable developmental goals, we have to bring down the MMR to less than 70 per 1 lakh live births by 2030. Now India is also currently following the SDG goal only, and if they ask what is the goal for India as per the National Health Policy 2017, in the 2017 we thought that by 2020 we will be bringing down the MMR to 100, but currently we are following the SDG goal only, and that is to bring down the MMR to less than 70 by 2030. Then they also ask one question, that what is how to calculate the total number of the pregnancies. Now whatever the total live births given, add 10% extra to that, and that will be equal to total number of the pregnancies in that area. The next question what they ask is that how much of the pregnancy should be registered at a time. The half of this total pregnancies should be registered at a time in antenatal register. Mind my words, it is not the half of the live births, half of the total pregnancies. ठीक है, तो live births है तो first can add 10% extra to get a total pregnancies, and then half of that will be registered at a time in antenatal register. Now we can be reducing the maternal mortality ratio if we had a good antenatal, natal and the postnatal care. The first question, which worker is responsible for this care in periphery? It is a multi-purpose worker, female. Okay, then every pregnant patient should be registered. There should be the minimum antenatal visits should be 4 as per the Government of India and 8 as per the WHO. If 8 is not given in your choice, go for the 4. And ideal visits are around 13 to 14. But if you go with the minimum these 4 visits, the at least one visit should be home visit by multipurpose worker female to look for the social conditions, and the third visit should be at the PSC, should be done by medical officer. Okay, and during these visits we will be going for proper checkup of a lady, blood pressure check karte hain, urine albumin, sugar, hemoglobin estimation, blood sugar we are checking for, gestational diabetes. Then we are giving the 2 doses of the TD vaccine if it is primary gravida, or the 1 dose if it is in a multigravida who has delivered within past 3 years. Then we are starting the iron folic acid tablet. Now just listen carefully. Now if it is a prophylactic iron folic acid tablet, means if a hemoglobin is more than 11 gram, then we have to give prophylactic. Okay, because cutoff level for anemia is 11 gram hemoglobin percentage in pregnancy. In that case, we are starting tablet once a day from 4th month of the pregnancy onwards till the delivery, means for the 6 months or 180 days before the delivery. Okay, and what is the composition of that iron folic acid tablet? It is having 60 milligram of elemental iron and 500 microgram of the folic acid. Okay, this 60 milligram of elemental iron may be in the form of 200 milligram of ferrous fumarate or 300 milligram of the ferrous sulfate salt, whatever it could be. But elemental iron, you can remember, is 60 milligram and 500 microgram of folic acid. But if she is anemic, anemic means if a hemoglobin is less than 11 gram %, in that case, suppose in the first trimester visit hemoglobin is less, in that case we are starting the therapeutic iron folic acid even in the first trimester also. And if you are giving a therapeutic iron folic acid tablet, then it is dose is twice a day, means morning and evening, 2 tablets in a day we are giving. Okay, so this is for 6 months we are giving prophylactically iron folic acid tablets. Okay, so don't confuse, prophylactically dose is once a day, therapeutically dose is twice a day. Okay, then we are also adding the calcium tablet from the 4th month onwards till delivery. Then these 3 investigations we are doing at the subcenter: hemoglobin for anemia, urine albumin sugar for detecting the pregnancy induced hypertension, and blood sugar for detecting the gestational diabetes. Then if she is going to PSC for one checkup, then blood group, VDRL, hepatitis B and the HIV testing are done at level of PSC. Okay, and in the routine checkup, if at any time the multipurpose worker comes across that she is having high risk, then immediately she is being referred to the higher center. Okay, but if she is low risk, then she is allowed to deliver at sub-center. So sub-center per low risk multi-gravidas can be delivered. Even if she is a low risk primary gravida, then she is advised to deliver at PSC because she requires episiotomy, which is given at and repaired at PSC. It is not repaired by multipurpose worker female. But if she is a high risk case of either the primary or multi, she is advised to go to the CSC onwards for the delivery, because if she needs cesarean section, it can be performed there. We are also giving the single dose of albendazole 400 milligram in the 4th month onwards, anytime in the 2nd trimester, because worm infestation is also one of the major cause of anemia in India. Then natal care mein, if she is a low risk multigravida, we are conducting the delivery at subcenter by keeping the 5 clean methods by the use of disposable delivery kits. And what are these 5 clean methods? The sheet we are putting under the patient for the clean surface. Then we are washing hands and putting gloves as a clean hands. And there is a blade, sterile blade to cut the cord, clean cut. Then there is a cord clamp or the sterile thread to tie the cord. And that is the sterile spit swab to just clean the stump and leave it dry, that is clean stump. Okay, and during delivery, if any time she comes across that any abnormality is happening, immediately the patient is referred to the higher center. So if a question is asked, the lowest institution where we can conduct the delivery is the subcenter type B, because type A may we cannot be conducting the delivery. But lowest place where the delivery can be conducted even at home also by the TBA, but under the supervision of multipurpose worker female. So read the question very carefully. Then once she delivered, multipurpose worker female is looking after in postnatal period, and the average or the ideal postnatal visits are 6, that is once a week, but minimum is, if she is in having a hospital delivery, then 3 visits are there starting from the day 3, 7 and day 42. Okay, then we are also continuing the prophylactic iron and the calcium for next 6 months when she is having exclusive breastfeed. So 6 months before the delivery and 6 months after the delivery, we are giving prophylactic iron and calcium to the pregnant patient and the delivered patients. Okay, then just after the delivery, for birth spacing, we are putting the copper IUCD within first 48 hours of the delivery, and as multipurpose worker female can also insert the copper T. That's why once she is getting delivery at the subcenter, this IUCD can be inserted. It is for the birth spacing. Then prophylactically, vitamin A we are giving to the baby only after 9 months. So first 9 month the baby will not have a deficiency of the vitamin A. For that, we are giving the 3 ml or the loading dose of 3 lakh international unit of vitamin A is given to the mother. So through the breast milk, the vitamin A is going to baby, and baby is having good amount of vitamin A, because vitamin A deficiency is a very important cause of blindness and loss of vision in our children. So to avoid that, we are giving 3 lakh or 3 ml of vitamin A to mother. Now, if we talk about the prevention in the pediatric duration, we should be knowing the periods. Okay, so any mortality in the 0 to 5 year is called as under 5 mortality. 0 to 1 year is an infant period, infant mortality. 0 to 1 month is a neonatal period, so neonatal mortality. 0 to 1 week is early neonatal. 1 week to 1 month is a post neonatal, late neonatal, sorry, and post neonatal is after 1 month. 1 month till 1 year is post neonatal. Okay. And peri is around the delivery, means any death of a baby intrauterine from 28 weeks of pregnancy, that is the age of viability, till 7 days after the delivery. In any period, if any death is happening to the fetus or the baby, that is included as perinatal period. And all these mortalities are expressed as per 1000 live births. So sometimes they can asking a numerical to calculate the early neonatal, late neonatal, post neonatal, infant or perinatal. So see question very carefully what period they are trying to ask. Now, if we just go with the recent updated values of these various pediatric mortalities, again as per the SRS September 2025 report, India ka the infant mortality rate is reported as 25, neonatal mortality rate is reported as 19, post-neonatal as 6, and perinatal mortality is 18. Now, another question is that which is the best indicator of the MCH care is perinatal mortality rate. Now, another question is asked is early neonatal mortality rate is a part of. Early neonatal is a part of neonatal also. It is a part of infant mortality also. It's a part of under 5 mortality also. It is a part of perinatal also. But it is not a part of late neonatal as well as post neonatal. Okay? So remember this point, and based on this we should be able to calculate the numerical. Now, how we can be reducing these pediatric mortalities, and by motivating or promoting for the breastfeeding to be started as soon as possible just after the delivery, maximum within 1 hour of a normal delivery, within 4 hours of the cesarean delivery. 6 months exclusive feed, and for next 2 years it is supplementary feed is there. Now, what is the difference or the comparison between the breast milk and the cow milk? The breast milk is having below of the protein 3 times lesser than the cow milk. Cow milk में 3.3 gram percent है, breast milk में 1.1 gram percent है. It is having a lesser amount of fat. It is having the lesser amount of sodium, so less load on the kidney, the lesser amount of absolute calcium or phosphorus, and the lesser chances of infections. Okay. But if you see in contrast, which is high in the breast milk, it is having a high of a whey protein or the whey casein ratio, which is a good quality protein. Then the iron content is high, the calcium phosphorus ratio is high, that is important for calcium absorption. So in spite of a low calcium or phosphorus, but better absorbed because calcium phosphorus ratio is high. Then it is having more of immunoglobulins, rather only immunoglobulin present in the breast milk, more of a lactose to give a energy, and although the fat is less, but DHA is present, which is responsible for the brain growth of the baby, as well as although the protein is less, but cysteine and taurine, which is again essential amino acid for brain development, it is more in breast milk. And that's why we say the breastfeed babies are having the better IQ over top feed babies. If we talk about iron little bit, iron is absolute concentration is low in both breast and the cow milk. But if we compare that, breast milk is having little bit more iron than cow milk, okay, and it is having better absorption. Okay, and if we talk about the vitamin K is absent in the breast milk, vitamin D is low and it is in the water soluble form, and the rest of the vitamin depends upon the mother value. If a mother is less or deficient, then obviously the baby will be deficient. In the cow milk, the vitamin C is low. Then for promotion of breastfeed, we are having the first week of August as a breastfeed awareness week. Then we are starting on my activity, that is a mother absolute affection, and having a baby friendly hospital concept, like keeping the baby by the side of the mother and cradle, so demand feed should be given. Okay, so this is all about our breastfeeding. Then growth monitoring, the very important questions are asked is that where it is done at the ICDS centers by Anganwadi workers. Okay, now best parameter we take is that is weight for age, because weight for age, low weight for age, it is suggestive of both acute and chronic malnutrition. But if we only compare the weight for height, and if it is low weight for height, we say it is an acute malnutrition, or it is the wasting, or if it is low height for the age, it is suggestive of the chronic malnutrition, and it is called as stunting. Okay, but the preferred is weight for age, which is giving both acute and chronic malnutrition. Now in the ICDS growth charts, we are having the three curves. Okay, now the upper line, three curves or three lines, the upper line is representing the 50th percentile, then the second line is representing the -2 SD, and the third line is representing the -3 SD. Now here a golden rule of the statistic, like any value, if it is within plus minus of the 2 SD, it is normal. So baby weight, it is coming between the first and the second line, it is still -2 SD, it is normal, green zone. If it is between -2 to -3 SD, means the second and third line, that is a yellow zone, baby is in a mild to moderate undernutrition. And if it is below the third line, it is a severe undernutrition, and baby, it is in the red zone. So sometimes they give you the standard deviation, so don't confuse. If they say the baby weight is weight for age is coming as a -1.5 SD, it is normal, because still -2 is normal. If it is -2.5, so it is mild to moderate or yellow zone, but if it is less than -3, then it will be in the red zone. So these words are very, very important. Now in the rural area, we are recording the birth weight, which is with the scale that is called as a Salter scale, a cotton bag here, and this is the meter, which is just hung on the wall, and we put the baby in this bag, and we hang this bag from here and record the weight, and this is the function of Asha worker. But if it is the institutional deliveries, then we are having the weighing scale, and we can be recording a weight there. So till 6 years, the baby is dealt in the ICDS centers, and after 6 months, 6 years, the baby is going to school. So from the 6 years till 18 years, the baby health is taken care in the school under school health. Now we are doing the checkup 6 monthly for overall health, for eye checkup, and every 6 monthly we are giving the albendazole tablet also. Okay, so health checkup, it is under the function of primary health centers, and it is either done by the medical officer, or most commonly through the mobile van. The Ayush doctors are going to the school and ICDS centers, and they are doing their checkup there. And most common problem which is coming across in the children is the dental diseases. Now eye checkup is usually done by the teacher, so first preference is given to the teacher. If it is not in your choice, then it is by paramedical ophthalmic assistant in vision eye center. If teacher is checking, then if a vision is found to be less than 6/9, then the child is referred to the paramedical ophthalmic assistant in the vision eye center for correction of the refractory error and providing the glasses. So this vision eye center, or the primary vision center, it is covering 50,000 population, and it is having the posting of paramedical ophthalmic assistant. Ophthalmologists are not here. Ophthalmologists are posted in a secondary vision center, and that is covering a population of 5 lakhs. Okay? Then albendazole we are giving every 6 monthly on the national deworming days, and national deworming days are 10th of February and the 10th of August. अगर single based answer लेना है आपको, so 10th of the February, because earlier it was only the one day, but now we are giving twice in a year. Weekly we are giving iron folic acid tablets, and the doses we had already discussed earlier in our nutrition topic, that the adolescent के लिए 10 to 19 years के बीच में the blue color tablet is there, and 60 milligram elemental iron and 500 microgram of folic acid is there. And for the children of 5 to 9 years we are having the pink color tablets. ठीक है, and space required per student in the school is 10 square feet per child, and minus type of the desk should be available. Then ventilation area, that is door and window area, should be around 35% or more of a floor area. Now in those schools which are having enough space, the UNICEF is funding them for growing their own vegetables and fruits, or developing the school gardens, and that vegetable can be utilized for making the midday meal, and this is what is applied nutrition program. So it is funded by UNICEF to the school who are having enough space for developing the school gardens. Then school health and wellness program is now merged under the Ayushman Bharat program. Ayushman Bharat program में the two activities were merged. One was school health and wellness program, and the health and wellness centers also. ठीक है, health and wellness centers which are now giving the primary health care, they are all included under the Ayushman Bharat program. So under the school health and wellness program, in every school we are selecting the two teachers, one male and one female, that are called as the health and wellness ambassadors. They are conducting health related activity, and weekly or monthly or quarterly. Weekly, the day Tuesday it is chosen, and weekly mainly they are giving a weekly iron folic acid tablets, and 2 students per class we are taking as health and wellness messengers, which are spreading the message in the community. Now all these activities are being conducted under a very important program that is called as National Health Mission. Now it is called as Pradhan Mantri Samagra Swasthya Mission, because not only the mother and the child health services, but other programs are also under this umbrella of this program. So this Pradhan Mantri Samagra Swasthya Mission now includes the MCH care, the TB elimination program, the vector-borne disease control program, program for control of the blindness and visual impairment, the mental health program, and program related to non-communicable disease. But this is not including the program related to the AIDS and the cancer. Okay, and this is a very important logo, that is husband, wife, child, and this is the son. Okay, and don't confuse this with the family planning logo, because family planning का जो logo है और family welfare program का logo, that is having the inverted triangle. Inverted triangle है उसमें, and then there is the husband, wife, and there is a small baby. Okay, there is no sun logo is there, and it is an inverted triangle. So don't confuse this logo. This is a logo of National Family Welfare Program. Okay. Now, coming to what are the components of this Pradhan Mantri Samagra Swasthya Mission. One is RMNCH plus N, means everything related to, earlier this was called as RCH program, that is reproductive and child health, but now we had included the other components also. So in addition to the reproductive, the maternal, the newborn, and childhood, adolescent health, and the nutrition. Okay, so these are the components included, and it is called as a 5x5x5 matrix strategies. Okay, because these are the 5 areas where we are giving the services like reproductive, maternal, newborn, childhood, and the adolescent. Okay, and 5 cross-cutting strategies are there. So don't confuse the 6x6x6 strategies for the Anemia Mukt Bharat program, 5x5x5 matrix strategy, it is for RMNCH plus N. Okay, and every pregnant patient should be registered. Then we are having a mobile units also, national mobile medical units. Then we are trying to track each and every patient that to get a good care and medicines. Now other activities we are doing for improvement in MCS services, and here the question is, number 1, it could be a logo. Pregnant patient, it is in safe hands. This is the logo of Pradhan Mantri Surakshit Matritva Abhiyan. Now here the 2 points. Number 1, that free antenatal care by private doctors. Okay. Second is when 9th of every month. Okay. So these are the 2 points. Then coming to the next is when they examine the patient, they are putting a sticker, because ultimately these patients are going to deliver in government sector, and government sector mein there is too much of rush, so they are not going to know who is a high risk and who is a low risk patient. So if their patient is low risk, they are putting a green sticker. If a patient is high risk, they are putting the red sticker. And high risk maybe if it is having a gestational hypertension or pregnancy induced hypertension, PIH, blue sticker, B for blood pressure, and yellow is for gestational diabetes. Okay, so the doctor delivering the patient in government sector can come to know the patient is high risk. Then the next important logo is Matru Vandana Yojana. Okay, the Matru Vandana Yojana, this was for promotion of hospital delivery for primary gravidas, because they had a complications. So the government decided that every primary gravida who is getting registered hospital delivery, vaccination to the baby, contraceptives, should be given a total incentive of 5,000 rupees in 2 installments. So first point is that what was the aim of the Matru Bandhana Yojana? For promotion of the hospital delivery, especially for primary gravidas. Second question, that how much is the total cash incentive is given? It is 5,000 rupees, irrespective of the religion, irrespective of the income, family income, socio-economic status. It is 5,000 rupees. The third is the logo of this program. The fourth is it is given in the 2 installments, 3,000 plus 2,000. Okay. So first installment is given after 6 months of the pregnancy, provided that one antenatal checkup has been done, and remaining 2,000 rupees, and just make it a correction, it is given after 14 weeks of the delivery. Earlier we used to say that after 6 weeks, but now we say 14 weeks after the delivery, provided she shows the certificate that she has a hospital delivery, then she had accepted the contraceptive after the delivery, and baby had received the first, second and third doses of the vaccination, like 6, 10 and 14 weeks vaccination after delivery. Okay, and this is in all the patients, but in certain situations, this another time we are giving the cash incentive. ये आप सब में नहीं देते, confuse नहीं करना, ठीक है? 5,000 तो we are giving to each and every pregnant patient who is getting pregnant for the first time. तो उसमें 3,000 in the pregnancy and 2,000 after the delivery. But suppose the patient is now second time pregnant, and first she had a female delivery, female child, and this time again after the delivery she comes to know it is a female child. Okay? So a single installment of 6,000 rupees is given 14 weeks after the delivery of the second baby, provided it is also a female. अगर first female है and second female है, then only in that case 14 weeks after the delivery of this baby we are giving 6,000 rupees. अगर previous male है, then it is not given. Previous female and this time male है, again it is not given. ठीक है? Now Suman, this is again a change logo. So because in the workbook the earlier logo is printed out, so this is a new logo for the Suman. Suman is the Surakshit Matratva Ashwasan, and we should be trying for zero preventable maternal and the newborn deaths. Then Kilkari, again important question. It is a mobile application, and this could be your image based question, K for the Kilkari, and here we are getting the audio messages every week. Okay, weekly audio messages we are having. Okay, not the video messages, not the text messages, we are having the weekly audio messages. Now Lakshya is improving the quality of the labor room services. Dakshita, we are giving the regular training to the health worker for better MCH care. So these are the certain activities coming under this program. Then another is the Arman. Arman is advanced reduction in mortality and morbidity in mother and newborn baby. ठीक है, and this is the logo for Arman. Okay. Although you will be talking about treatment of anemia in your gynae classes, so it is I just want to highlight that how we are treating the anemia in our pregnancy. Normally, the hemoglobin percentage, if it is less than 11 gram, we say that patient is anemic, and if it is hemoglobin is 10 to 10.9, it is a mild anemia. If it is 7 to 9.9 or roughly 10, it is a moderate anemia. If it is less than 7 gram, it is a severe anemia. Then we had a 3 option: either you can give iron tablet, you can give injectable iron, or you can give blood transfusion. Now this depends upon, number 1, what is the gestational age of the pregnancy, and second is that what is the severity of anemia, and the third is whether the patient is able to tolerate oral medicine or injections or not. So अगर mild to moderate anemia है, and in that case twice in a day or the 2 tablets of iron folic acid we are giving. But अगर pregnancy is more than 34 weeks, we don't have enough time for oral tablet, in that case or patient is not able to tolerate the oral iron because there is a risk of gastritis, in that case we are giving the iron injections, and ferric carboxymaltose or FCM injections are preferred. But if the patient is a severe anemia, and then it is depending upon the hemoglobin, means less than 7 gram is any severe anemia. In that also, if a hemoglobin is between 5 to 7 gram percent, then if it is less than 34 weeks, then we had enough time, we can give the IV iron injections, and iron जो injection दिया जाता है IV दिया जाता है for the ferric carboxymaltose and FCM injections, and if it is more than 34 weeks, then we can be directly going for blood transfusion. But if a hemoglobin is less than 5 gram, irrespective of the gestational age, we have to give the blood transfusion. So 5 gram अगर है, irrespective of gestational age, we have to give blood transfusion only. So this is how we are treating our anemia in pregnancy. Now coming to the second activity is Janani Suraksha Yojana. Now Janani Suraksha Yojana, the ASHA is a main worker for this program, and it is for promotion of the hospital delivery, and we had already talked about we are giving some incentive to the patient and some incentive to the ASHA workers or USHA workers also. So it is depending upon the rural and urban areas, and the second is the states are divided based on the performance. If we are having a good number of the hospital deliveries, means they are the high performance states. So high performance states may we are only giving to the BPL families or the SC/ST families only up to the 2 deliveries, okay. But in the low performance states we are giving to all the women and till all for all the deliveries to promote for their hospital deliveries, ठीक है. So जो health worker है, आशा worker है, in the rural areas में it is given a 600 rupees irrespective of the state, and in the urban area, that is urban ashas or ushas, are given a 400 rupees irrespective of the state. But patient के लिए in the rural area, in the low performance states 1400 and high में आधा है 700 है, and patient के लिए urban areas में 1000 is for the low performance states and 600 is for high performance states, ठीक है. So the question has been asked that this much is to the ASHA, this much is to the patient where the delivery has been conducted. Now coming to when we had seen the good success reduction in maternal mortality by the GSY scheme, now we had started giving the services to the babies also, that if they are sick, then we are doing their free hospital transport, free admission, and the free medicine are there. Okay, so earlier we were only giving till 1 month. Shishu is called as a neonate. So this was a Janani Shishu Suraksha Karyakram, but now we had extended till 1 year. So now the services are coming till 1 year of infant under this JSSK scheme. Now this is an important logo of the JSSK, that is Janani Shishu Suraksha Karyakram, and for this under this program, the JSY Janani Suraksha Yojana activity is same as the JSY guidelines, and baby के लिए क्या है, that we are having the home based newborn care by ASHA, And home-based care of the young child visits we already talked about. This is for early detection of any problem in our newborns, neonates and infants. Then if a patient is going to hospital subcenter and there on the clinical ground the patient is examined under the IMNCI, and based on the severity of the problem the patient is classified into the three categories. Green means can be managed at home, and yellow means having some problem which we don't know whether it could be curable or not. So we treat and we do the follow-up. If baby is improving, then continue the treatment. Not improving, then we have to refer the baby to the higher center. And pink means a high-risk babies are immediately we are referring after stabilizing. And this is applicable for the children of 0 to 5 years. And multipurpose worker male is categorizing these patients based on the clinical examination. And this is for rather 5 diseases के लिए we are going for this IMNCI program, that is ARI, acute respiratory tract infections, then diarrhea, and M3 or MQ, it is measles, malnutrition and malaria. So these are the 5 diseases which are under this program. Then we are having at each delivery point we are having for the center for resuscitation of the baby, that is newborn care corners. But suppose if a baby is having hypoxia, baby is referred to the CSC because there is a pediatrician. So at the CSC we are having the newborn stabilizing units, and if a baby requires ventilation we refer the baby to the district hospital onwards, which is the special newborn care units. They require the ICU's care. Okay? So and if a baby is found to be having severe malnutrition, okay, the severe malnutrition, how we can see that if a mid-arm circumference is less than 11 gram percent, or a weight for a height or the weight for age for the baby is less than -3 standard deviation, and there is a edema, so it means the baby is having severe malnutrition. So we are admitting the patient in the nutritional rehabilitation centers and we are giving IV nutrition to these babies. Then we are having another program that is called as the Rashtriya Bal Swasthya Karyakram. Bal means what we call as the child age. India mein the child age is 0 to 18 years. So now we are dealing these children at the 2 places, 0 to 6 years we are dealing in the ICDS centers, and the 6 to 18 years we are dealing under the school health. And here we are doing their 6 monthly health checkup for detection of any of the problems. 4D, what we say, the detection of any diseases, the defects, developmental delay or deficiencies. And this is under the program, this is under the function of primary health centers. And as I told you, either the medical officer is examining, but most commonly the team is going from the PSC to these schools and ICDS centers, and that team is called as the medical mobile health team. Medical mobile health team, that is called as, okay. And what are the members of this medical mobile health team? We are having the 2 Ayush doctors, 1 male and the female doctors, and there is a 1 staff nurse and 1 is pharmacist, which is expert in having the data recording also. So they are visiting to the ICDS centers as well as to the schools. Every 6 monthly they are examining the children, and if they found any problem having the any disease, it is referred to the higher center. Then we are having the another group as the Rashtriya Kishore Swasthya Karyakram. So अगर problem यहाँ पे आती है तो that baby is referred to the district, and this is for the treatment, and it is called as a district early intervention centers. So DEIC में these are referred, ठीक है, for their management. So these children are referred to the district hospital under the early management, and that is called as the district early intervention centers we had. Now another program is Kishore Swasthya Karyakram. Kishore में आपको क्या याद रखना है? Number 1, adolescent age. Who are the beneficiaries? Adolescent age is 10 to 19 years. Second is what activities we are having. We are dealing with their adolescent problem. Maybe their drug addiction, maybe their violence nature, maybe their mental health, maybe their non-communicable diseases, menstrual hygiene problem in the female, as well as sexual health. So we are having a special clinics that are called as ARSH clinics, adolescent reproductive and sexual health clinics are there. Then we are training our workers who are conducting the delivery for the newborn resuscitation, because many babies, they lose their life if a proper resuscitation is not done. So this is a 2-day training program to save our newborn babies and indirectly reducing the infant mortality rate. So this is all about our this topic, as prevention in pediatric and obstetric, a very, very important topic. Extra age point में we know that the average weight gain is 9 to 11 kgs. Then population norms, we had already talked in a different places, that is less than 50,000 population is under the rural health mission, more than 50,000 is under the urban health mission. ASHA worker is covering 1,000, USHA is covering 1,000 to 2,500 population. And ambulance emergency numbers 102, if you are calling, it is to take the pregnant patient to the hospital for the delivery, and 108 to transfer any of the patient who is requiring emergency transfer. And this is a 5 into 5 into 5 matrix strategy. It is for RMN CH plus N. Again, the nutrition is a very, very important topic from our examination point, and you know, the questions mainly asked is nutrition related national programs. Second is from the food adulteration. The third is from caloric requirement and extra calories in pregnancy and lactation. The fourth is the daily requirement of the different nutrients in the diet. Fifth is they ask a question about milk hygiene, how we are doing the pasteurization and what tests we are doing before and after pasteurization. Now, this is again an image based question. This is a flower of Argemon mexicana, and its black seeds are mixed with the mustard seed and their oil, if it is mixed, leading to a disease, that is epidemic dropsy. Okay, this is again a image based question, and this is letharism. Letharism mein there is a spastic paralysis of lower limb, and initially there is a weakness. Patient is not able to stand, difficulty in standing and walking, might be using the 1 stick then 2 stick for that, and it is because of mixing of this Lethara sativus pulse in the yellow pulse or chana dal, Bengal gram also, and this is releasing a toxin, that is BOA, beta oxalyl aminoalanine. Then there could be the ergotism, that is peripheral spasm leading to a gangrene. Then there could be the endemic ascites because of mixing of these Crotalea seeds, Ginginia seeds with the small millets, or storage of the grains in presence of moisture develop the fungus, leading to aflatoxin release causing liver cancer. So we should be knowing this table is very, very important, and here the disease, the toxin, the agent, and in which the agent or the food, another food stuff is mixed. Okay. So first disease is letharism. It is because of the mixing of Lethara sativus pulse in the yellow pulse, or it is also in the Bengal gram or chana dal. Okay, yellow pulse or the Bengal gram. Chana dal. Okay, and the pulse is Lethara sativus. Now, the very, very commonly asked question is that how we can be having prevention for that. So, first of all, we have to educate the community, don't eat this type of pulse. We can be banning the cultivation of crop in that area. Very commonly asked is which vitamins supplementation is preventing this condition, that is vitamin C. We are giving in a dose of 500 milligram twice a day for 7 days or to 10 days. Now, this toxin can be removed because it is a water soluble toxin, either by a steeping method or parboiling method. Steeping means that we will be soaking in hot water for 2 hours and automatically toxin is removed, or parboiling means overnight we are soaking in a lime water, okay, and morning mein we are doing the partial boiling. So, if you can remember that it is a water soluble, remove the toxin by steeping or parboiling method, it will be more than okay. Okay. So, ban the crop, then health education, vitamin C supplementation, and the toxin removal. The second very important is epidemic dropsy. How we had remembered the toxin EDS, BDS. Okay, BDS is the dental course, so EDS, BDS, S is the sanguinarine. So this sanguinarine kahan se aa raha hai? It is because of mixing of Argemon mexicana seeds with the mustard seed, and when oil is taken, it is having this toxin, and it is actually causing the peripheral swelling, leading to ultimately cardiac failure. Now, if a oil is given, how you can be detecting the contamination? Either we can be detecting by the nitric acid test or by the paper chromatography, which is highly sensitive, paper chromatography, because it can detect up to 0.0001% of contamination. Then the third is endemic ascites, AP. It is because of toxin pyrrolizidine. कहाँ से आ रहा है? It is because of intake of Protorella seeds along with the millets, and this toxin, it is causing damage to the liver, that's why causing ascites. Now another toxin which is causing damage to the liver is aflatoxin, but it can lead to the hepatic cancer. Now this aflatoxin, from where it is coming, it is through, from the fungus, that is Aspergillus flavus. Where this is growing on the grains during the storage if moisture content is high. Okay, so if a moisture content is not there, so the fungus will not grow, but if the moisture content is high, then this fungus will grow, and this will be releasing the toxin, aflatoxin, which is causing the liver cancer, and most commonly it is seen in groundnuts. Okay, so we have to store the groundnuts very carefully, avoiding moisture. Then there is another condition is ergotism. It is because of the ergot alkalis. Now from where these are coming? These ergot alkalis are again coming from a fungus, that is Claviceps fusiformis, but this fungus is affecting the plants when they are still in field and before the seeds are formed in the flowering plants, and when we are eating those grains or the seeds which has already been contaminated with this fungus, and this is containing the toxin that is called as the ergot alkalis. Now if there is an acute poisoning mein we can be having the nausea, vomiting, diarrhea or dizziness, but agar severe chronic poisoning hai, continuously we are using, it is causing the spasm of the peripheral muscles, leading to gangrene, and most commonly this is associated with the bajra. ठीक है, जो बाजरा प्लांट है, इट्स अ टाइप ऑफ मिलेट है, जैसे मक्का, बाजरा, ज्वार, सो दीज आर ऑल अ स्मॉल मिलेट्स. तो बाजरा के साथ में जो है इट इज कॉमनली एसोसिएटेड. एंड अनदर, यहाँ से 3-4 questions has been asked is, like in the last exam they asked is, a family is using the bajra roti and they all had a nausea, vomiting, diarrhea. It is which poisoning? It is your the ergotism, acute poisoning. The second was that how we can remove these black color seeds. Either manually you can pick up, or you can be soaking in 20% of the saline, and these seeds will be coming on the top, and we will be removing those seeds. So this is all about a food adulteration, a very important area for our exam. Now milk mein, the milk, if your child is taking for a longer time, the child will be having deficiency of iron and vitamin C. Then the next question is, which is the most commonly used method of pasteurization? It is flash method or high temperature short time, where we are boiling for the 15 to 30 seconds only at 72 degrees centigrade. Earlier we were using the VAT method or the Holders method, boiling at 63 to 66 degrees centigrade for more than 30 minutes. Now some tests we are doing before pasteurization to know the contamination. It is a methylene blue test, and some tests we are doing after pasteurization to know whether the organisms are completed or not. And the best test is a phosphatase test, when we are looking for the phosphatase enzyme that should be absent, and coliform count should be nil. And if you put this milk sample on the culture plate, then colony count should be less than 30,000 per ml. Okay, so these are done after pasteurization. Now balanced diet means a diet should be giving a good amount of energy from protein, fats and carbohydrates. So the question is, how much of the energy should be from the protein? 10 to 15%. From the fat, if they didn't mention, go for the WHO guideline as 10 to 30%, but in the Indian scenario it is 10 to 20%. Then caloric requirement, especially remember for the females, it is depending upon their ideal weight, height. So if an ideal standard height weight person we are taking, then as per the work, sedentary female 1700, at +4 2100 for moderate female worker female, and +6 is the heavy worker female. But extra calories if you go for in the pregnancy, extra calories in the first trimester, no extra calories is required, but if they don't mention the trimester or they simply ask how much is extra calories required in pregnancy, it is 350 extra to the basic one. Like a moderate worker female hai, to basic hai aapka 2100 plus 350. So like this, you have to see the question carefully. They are asking the extra calories, they are asking the total calories, they are asking in the first trimester, they are asking in the second or third trimester. ठीक है? And lactation में first 6 months में it is a plus 600 and after 6 months में it is a plus 520 calories are there. ठीक है? Now daily requirement doses, this chart is very important, and yes, it is difficult, and repeatedly you have to see and try to memorize this. Okay, like vitamin D is constant in non-pregnant, pregnancy and lactation as 600 international units, but calcium is more in the lactation, that is 1200, and in pregnancy 1000, and non-pregnant state may again it is 1000. Now iron, it is in the pregnancy it is 27 milligram per day, and 23 milligram in lactation is required. Vitamin folic acid, that is B9, is also important. Maximum requirement in the pregnancy, that is 570 microgram. Then we are also having increased requirement of iodine in pregnancy. Now earlier it was 250, but now it is updated guidelines say it is 220 in pregnancy and 280 in lactation. Okay, so these values are important, we have to remember. Now another question is asked is that what nutritive value we are providing, whether it's an average value or it is an RDA value to the community. So RDA value is preferred. RDA means a recommended dietary allowance. Okay, so the question is that which is preferred, average estimated average requirement of recommended dietary allowance, so RDA is preferred. Second is RDA value is covering how much of the population demand. Actually this is the mean value and plus you had a 2 SD value in that, so it is actually covering the demand of 97.5% population. Okay, while the average requirement is only covering the demand of 50% of the population. Okay, so always remember in nutrition RDA is preferred and it is fulfilling the demand of 97.5% community. Now if you go with the nutrition related national programs, the nutrition related national programs, one is a midday meal, important logo, the ministry is education, and the food is given as half of the calories and half of the protein and 1/3 of the calories for that age. Vitamin A prophylaxis program, extremely important program. Okay, so see the question carefully. The first question, that which is the first symptom of deficiency? Night blindness. First sign, conjunctival cirrhosis. But conjunctival cirrhosis cannot be clinically appreciated in school or examination. So most common clinical sign which you are taking for screening in children is white spot. Most sensitive screening test is serum retinol level. When we can say it's a major public health problem, when prevalence of night blindness more than 1%, white spot is more than 0.5%, and serum retinol level less than 10 microgram in more than 5% of the population, then we can say it's a major public health problem. Then we had a WHO classification of the deficiency symptoms, because deficiency is known as xerophthalmia. So we should be knowing the gradings also. The xerophthalmic grade 1A corneal xerosis means as per the severity. Then we had white spots, then xerophthalmic 2, corneal xerosis, corneal ulcers, then keratomalacia. So at least the primary signs are important. Now treatment and prophylaxis. Now please read the question very carefully. They might be giving a scenario of the deficiency or some clinical case, but they are asking the prophylaxis. Okay? Or they are asking giving a scenario of the prophylaxis and they are asking the treatment. So read the question very carefully. If they are asking about the prophylaxis, we know that we are starting the vitamin A at the 9 to 12 month में 1 dose 1 lakh and remaining 8 doses 1 year plus till 5 year every 6 monthly. If a baby weight is 8 kg plus 2 lakh dose or 2 ml per dose, or if a baby weight is less than 8 kgs more than 1 year then that dose is 1 lakh. ठीक है, but अगर therapeutic है, so therapeutic we are starting whenever the child is having the problem. Prophylaxis only started after 9 months. If you had any doubt, you give the vitamin A to the mother, not to the baby. But अगर deficiency symptom है baby में, then you have to give to the baby. ठीक है. Now here for the treatment we are giving the 3 doses today, tomorrow and after 2 weeks. What dose depending upon the baby age and weight. 0 to 6 month का baby है तो 50,000 international unit per dose means 50 today, 50 tomorrow, 50 after 2 weeks. 6 to 12 month का है 1 lakh international unit per dose. अगर more than 12 month का है depending upon the weight, less than 8 kg 1 lakh per dose, more than 8 kgs or 8 kgs 2 lakh per doses. ठीक है. Now little bit a higher point if you can remember. अगर child is having the measles, because we know the measles complication is diarrhea and diarrhea precipitates vitamin A deficiency. So if a child is coming with the measles, we are giving prophylactically 1 dose of vitamin A. If baby had not received the vitamin A in the past 1 month, like suppose अगर 1.5 year का baby आया है and with the measles and mother says the baby had received the vitamin A at 10 months of the age, so we are giving the 1 dose that is 2 lakh because baby is 1.5 year, so 2 lakh we are giving the 1 dose prophylactically to this baby. But suppose this baby is having measles and malnourished also, then we are giving the prophylactic 2 doses today and tomorrow. ठीक है. But if a baby is measles with vitamin A deficiency symptoms like beta-hepatitis, it means a deficiency is there, so we have to give the 3 doses as the treatment. ठीक है. So this is an additional that measles में prophylactically we are giving the additional doses of vitamin A. The next program is our Anemia Mukt Bharat program or Intensified Iron Plus initiative. Logo is very important. It is called as 6 into 6 into 6 strategy, and we are having the 6 beneficiaries, 6 interventions and 6 institutional mechanisms. So beneficiaries are important and the interventions are important. ठीक है. So interventions क्या करते हैं? Number 1, we are giving the prophylactic iron folic acid supplementation. 6 monthly we are giving the albendazole tablet. Then fortification of the food is done, like salt is fortified with iron, Tata Plus salt is available in the market. Then we are having the test to treat and talk approach or talk strategy, means we are testing those anemic, we are treating and we are talking them that what type of food you are taking like this. So we are trying to avoid the nutritional causes of anemia also. Now what are the 6 beneficiaries and what tablet, color, frequency, composition. So this is very important. So this is again a flashcard showing a different strategies. You already had this flashcard, so try to remember these strategies. Then this chart is very important for the prophylaxis. Some mix and match questions are commonly asked in the exam. Okay. Now which are the 6 beneficiaries? Now please be very careful. It is not from the 0 to 5 years or 59 months, because till first 6 months nothing is given from outside prophylactically. Okay. So 6 months till 59 months or just short of 5 years, or you can remember as the 6 months to 5 years, 5 to 9 years, then adolescent 10 to 19, then 20 to 49 reproductive female, pregnancy and lactation. Okay. So ये 6 beneficiaries हैं. Now first is about the frequency. Now 10 year onwards, ठीक है, 10 year onwards means the adolescent onwards. This is adolescent onwards. Adolescent onwards, our frequency is, or the composition rather, if we talk about, it is the adult tablet, that is 60 milligram elemental iron and 500 microgram of folic acid. ठीक है. If we talk about the frequency, pregnancy and lactation में we are giving daily. Okay, we are giving daily, but from 5 year onwards till 49 years we are giving once in a week. Small baby cannot tolerate once a week, so we are splitting in the 2 doses, bi-weekly we are giving. Now how much is the composition for the small age group? that is 1 ml syrup, it is containing 20 milligram of iron and 100 microgram of the folic acid, and in between group is having in between composition 45 milligram iron and 400 microgram of folic acid. Okay? So this is the 6 beneficiaries, how we are giving, what is the composition. Now color tablets are also designed, that is small kids may 5 to 9 years, the tablet color is pink one. Adolescent 10 to 19 years, the tablet color is blue color, and 20 year onwards the color is, it is red color tablet is there. Now pregnancy mein the anemia, if it is less than 11 gram hemoglobin, we consider that lady is anemic. Most sensitive indicator of iron deficiency anemia is serum ferritin level, like serum retinol for vitamin A, serum ferritin is for this iron deficiency. Now, when we are treating a patient of anemia, initially hemoglobin increases and then extra iron is deposited in the stores. So, once after getting a normal hemoglobin, at least continue the iron folic acid tablets for 3 more months. Iodine deficiency or disease control program में 3-4 points. Number 1, when we can say it's a major public health problem, when the prevalence of the goiter is more than 10%. Second is, what actions we are taking? We are using the compulsory use of iodized salts and providing these iodine skin patches which are available in the centers by a name of Jeevan Bindis or life-saving dots. Actually, they are having this iodine in the gum, and when the lady is putting this dot bindi, so this is absorbed from the skin as a skin patch. Now the next question, that what are the indicators of success of this program, is the prevalence of neonatal hypothyroidism. It should be reducing if a good control of hypothyroid in the community, and extra iodine is there, it is excreted in urine. So urinary iodine level excretion. Now fluorides are again very important. Levels are asked repeatedly in the exam. Normal fluoride level in the drinking water is 0.5 to 0.8 milligram per liter of ppm. Maximum upper limit is 1.5. If it is beyond that, it is deposited in the joints, ligaments, causing fluorosis. Teeth may deposited leading to the yellowish teeth with the chalky white patches are there. This is dental fluorosis at a level of 1.5 to 3 ppm. Skeletal fluorosis, that is stiffness of joints, ligaments, tendons. Difficulty in standing patient is difficulty in the walking, that is skeletal fluorosis 3 to 6 ppm, and if it is too much, then patient will not be standing, will be crawling, and that is crippling fluorosis if it is more than 10 ppm. Now, if a fluoride level is more, we have to reduce. The technique is Nalgonda technique by adding the chemical as in order LAM, like a lye, alum and bleaching powder. Now, if a fluoride level is less, it is causing damage to the enamel and the nerves are exposed, leading to sensitivity, and this is called as dental caries. So, when the fluoride level is less than 0.5 ppm, it is causing dental caries. Now, National Nutrition Mission में और पोषण अभियान में our goal is to make an India free from malnutrition. Now, month of September is called as a Poshan Mah. The first week of September is called as Poshan Week. जैसे breastfeed awareness week था first week of August, and 15 days in month of April is called as Poshan Pakhwara. We are having all the nutrition related activities in these duration. Then micronutrients. Macronutrients, macro and micronutrients. Macro is protein, carbohydrate, fats and fibers, and micro is vitamins and minerals. So protein mein the best indicator for the protein quality is the digestible indispensable amino acid score. The best indicator of the protein quality deciding the amount of the protein intake is net protein utilization. Then what is NP value? Is amount of the protein which is retained in the body after digestion and absorption, and it is an indicator for protein supplementation. The protein with the highest NP value, egg protein with 96. Protein with the highest protein concentration weight by weight, soya protein with 42 to 44%. How much is the NPU of soya? 55. How much is weight by weight protein in egg? Is 10 to 14% only. Daily protein requirement 0.83 gram per kg of the body weight per day. Amino acids deficient pulses में mainly is the methionine, PCM, Cereals, TLC, mainly the lysine. Maize may mainly the tryptophan. So, the maize intake will cause pellagra because tryptophan is converted into niacin. So, low tryptophan, low niacin leading to pellagra. So, maize is called as pelagropagenic diet. Now, excessive intake of jowar or the sorghum is also causing the maize, this pellagra. It is not because of any deficiency, but excess of the leucine, which further blocks the conversion of tryptophan to niacin as a negative catalyst. So, small amount of tryptophan, whatever it is present, it is trying to convert into niacin, it is blocked. So, still pellagra is more if maize and jowar is taken together. Okay? Now, coming to the parts. The most important source of linoleic acid or most important essential amino acid source is safflower oil. The most important richest source of the linolenic acid is flaxseed oil. The source of DHA is the breast milk, which is required for brain development. Deficiency of the essential fatty acid will lead to phrenoderma. Now listen carefully because used to be asked as a question. Phrenoderma can be seen in vitamin A deficiency also. So if they say the phrenoderma with the bitote spot, it means vitamin A deficiency. If they say the phrenoderma with rough skin like a frog-like or toad-like is a essential fatty acids. Okay? We can be having the saturated, unsaturated or mono or poly. The best is poly followed by mono and then the saturated fatty acids. Carbohydrates may try to remember the glycemic index. All the fruits and vegetables are having the low glycemic index, that is less than 55, except potato, watermelon. Now, I am not writing the third one which is written in the park because it is controversial, and park says sweet corn is having high glycemic index, but in all literature says it is low glycemic index. So, I am not writing here. So, all fruits and vegetables are low glycemic except potato and watermelon. Commonly taken food in our day-to-day life is having the medium glycemic like pulses and cereals and rice, whole wheat, and white sugar, sugary item, the juices, sweets, energy drinks, they all are having the high glycemic index, especially the white flour, maida. And that's why we say that avoid junk food because it is having high glycemic index. Coming to micronutrients which are required in a smaller amount in milligrams or micrograms, minerals and vitamins. Usually all the minerals are micro, but one question was asked is that sometimes calcium is considered as a macro because calcium ka requirement kitna hai? It is around the 1000 milligram or it is equal to 1 gram. Okay? So sometimes in comparison to other minerals, it may be considered as macronutrient. Vitamin D is required for absorption of calcium and its metabolism. Ragi is a grain which is having high calcium content. Now, zinc deficiency will lead to delayed wound healing, diarrhea, hair loss. Now, very commonly asked image based question, acrodermatitis enteropathica. Two straightforward question, identify the image. Second is because of deficiency of which mineral, zinc, and third is where it is deficient. In the diet it is good, but there is poor absorption from intestine. Now, if it is a clinical situation, delayed wound healing with diarrhea, it is because of zinc deficiency. But agar delayed wound healing hai with bleeding gums है, scurvy, then it is because of vitamin C deficiency. ठीक है? Selenium is an antioxidant and its deficiency will lead to occasions cardiomyopathy. B1 thiamine, its deficiency will lead to beriberi and Wernicke-Korsakoff psychosis. The richest source is rice, and if you are using the polished rice, it is deficient. So, beriberi is commonly seen in the polished rice eaters, and that's why prevention is by parboiling of the rice. We are partially boiling the rice and from the outer coat the vitamin B1 goes to the middle coat. Before removal of the husk, we are doing partial boiling, and then husk is removed, and so this is preserved. Now it is showing the neurological complications. So another very commonly asked question, अगर neurological symptoms हैं along with the alcohol intake, it is commonly a thiamine deficiency. But if it is related to the maize intake, it is commonly related to pellagra or B3 niacin deficiency. Niacin, the diet which is precipitating is the maize causing pellagra. Image Castle-Neck appearance very commonly asked. 4D is diarrhea, dementia, dermatitis and death. Folic acid will lead to neural tube defects and megaloblastic anemia. B12 can also lead to megaloblastic anemia or subacute combined degeneration of myelin sheath of the spinal cord leading to neuralgic pains. Vitamin C, 2-3 points. This is bleeding gum, scurvy. Vitamin C help in the iron absorption also. This 1 point more you can add up. This vitamin C, it is help in iron absorption. So along with iron preparation, we are adding the vitamin C, or we can say that you take the iron tablet or capsule with a half glass of water and squeeze 1 lemon in that. Okay, make it rich in vitamin C. Richest source is amla or Indian gooseberry. Vitamin D, the deficiency can lead to rickets or osteomalacia. The most active form is 1,25-dihydroxycholecalciferol is calcitriol. Most active or strongest antioxidant is vitamin E. Vitamin K is deficient in the newborn baby, so every newborn should receive a vitamin K injection, otherwise there will be the bleeding in newborn. ठीक है, और जो natural forms हैं वो fat soluble हैं. K1 is phylloquinone and K2 is menaquinone, while synthetic is manandione is water soluble. Now, if you have to launch a food in national market, minimum requirement is as per the Prevention of Food Adulteration Act PFA standards. If we have to launch in India market with a good quality, we should be having the clearance of Bureau of Indian Standards BIS. Then if we have to launch in the international market, we should be fulfilling the criteria of Codex Alimentarius, and every company should be having the licensing number to launch product into the market, that is FSSAI number. Now, if you want to assess the nutrition status of a person, how much of the raw food that person is taking throughout a week, we will be counting, and this is called as one dietary cycle. So, one dietary cycle is not including the 124-hour food intake. It is the food intake for whole 1 week, okay, and that is the raw food intake for whole 1 week. That is one dietary cycle. So this is all about this topic of nutrition. The next is the topic of biostatistics. So we are having the 3 topics where we are having the numerical, the concept based, the content, the numericals. 2 we had already discussed, epidemiology and screening, and this is the 3rd topic. Data means observation, whatever the value we are collecting. If we can be measuring on a scale, it is quantitative. Not able to measure, it is quantitative. If it is quantitative, then how many numbers, possible numbers are there, and with the possible decimal values is there, means average if we can calculate, it is a continuous value, or if it is only a few decimal values or few possible values without any decimal, it is called as a discrete one. So usually the all quantitative data are the continuous data and qualitative are the discrete data. Okay? Now, very commonly they ask is that how we can be representing those data. First question, which is the best data presentation method for the continuous quantitative data? It is histogram. What are the other methods for the continuous quantitative data? Is frequency polygon and the frequency curve. Which is used to show the trends of events over the time is line chart. Which is used to show the relationship between the two parameters is the line chart, like over the time or with the age, what is happening to the weight of the baby in the ICD's growth chart is the best example of line chart. Or with the time, what is happening to the number of malaria cases, to the number of the COVID cases, this is also line chart. So trends of events over the time and relationship between the two parameters. Okay. Then scatter diagram is, it is used to measure correlation coefficient. Second is, what is this correlation coefficient? Is degree of association between the two parameters, means a constant relationship is there. Like line chart में constant relation नहीं है, यहाँ पे constant relation है. For one parameter will be increasing, the second is either increasing or decreasing. Range is -1 to +1. Baseline value is 0. Like RR और OR में it was 1, but यहाँ पे baseline 0 है. Any value between 0 to +1 positive association, risky 0 to -1 negative association or protective. ठीक है? So always remember the value will never go beyond this -1 to +1. It should be within that range. And this could be your image based question. This is an image of histogram. And basis histogram, if you are joining the center points of the bar, it is frequency polygon. If frequency interval is very short, and if you are joining, we get a curve like structure, it is frequency curve. Okay. Now scatter diagram, a little bit a higher point, if we can remember, normally it is not asked in FMG level, that we are having that imaginary dots hai, not imaginary, the values are there, and in where they are concentrated, we make an imaginary line. Okay. So more closer these dots are to the imaginary line, the higher will be the value. Okay. Like if it is increasing the x parameter, x axis parameter, y is increasing, it is a positive association. So value will be between 0 to +1. But यहाँ पे it is almost over this line. So this value will be roughly nearer to +1. Okay. It will be nearer to +1. Okay. But here the values are, or the dots are little bit deviated from this imaginary line. So here if I say the roughly, if I have to calculate the scatter diagram, it will be somewhere around 0 plus 0.67 or whatever can be. But if suppose the values are scattered very far away, so very low correlation coefficient value, as it is towards an plus side, so it may be plus 0.2 only, like this. Okay? So imaginary observations say you can have an idea that how much should be the correlation coefficient. यहाँ पे it is all close, +1 means a maximum association is there, and it is a very small or very little positive association is present. Now if it is towards a lower side, means if you are increasing the value on the x-axis, but the y-axis value is reducing, it is having the negative association. Okay? Same is like as in a correlation coefficient, because values are scattered little away from the imaginary line, it may be roughly -0.5. But यहाँ पे all are in a same line, so it is a very strong negative association, maybe -1. Okay? So like this, sometimes they are asking that what this graph is, what value you can calculate, or just imaginary what could be the correlation coefficient in this situation. Now qualitative data are simple by observation or by looking that picture you can have an idea. So it may be the simple bar chart, the gap is present in between the bar. Same bar mein if you are showing the multiple features, it is a component bar chart. If you are having a multiple bars for the different features, it is a multiple bar chart. Then total values are 100%. If you are just showing the percentage fraction of the values, it is the pie chart. Okay, with the map you are showing, it is the spot map analysis. With the pictures, if you are representing, it is your pictogram. Okay, Now, data calculation is important, and here the question is asked is that what are the measures of central tendency? Central tendency is measured by mean, median and mode, and the dispersion is measured by, commonly we will be talking only here is the range, standard deviation, relative deviate or the standard error, but other could be the coefficient of variation, variability, variance or precision also. Now, average of all the values is called as mean value, like a average of all divided by the total number of the values. So, sometimes they can be giving you the values and they can ask you to calculate mean value. Okay. Median is the arranging the value in the ascending or the descending order. अगर odd number value है तो directly the middle value, और अगर even numbers हैं so the average of the middle two values will be your median. ठीक है. And this is a formula, like in agar odd number values हैं, so number of the values plus 1 divided by 2, that number will be your median. Like suppose agar 7 numbers हैं or 7 values are given in that figure, so n is what? 7. So 7 plus 1 divided by 2, that is 8 by 2, or the fourth value will be your median. Okay? So like this you can be calculating if a higher the very large number of the values are given. Then agar even number have values hai, so how you can calculate the median? It is by the average of the n by 2th value and n by 2th plus 1th value. Like suppose total values जो हैं वो 10 values हैं, so 10 values में, so what is n? N is a 10, so 10 by 2, it means it is a fifth. ठीक है, so n by 10th कितना हो गया? N by 2 हो गया fifth value plus average और किसका लेना है आपको? n by 2 means 10 by 2 is 5 plus 1 is the sixth. So you have to take the 10 plus 2 1. So you have to take an average of 5th and 6th. You have to take average of 5th and 6th. ठीक है, अगर ये फॉर्मूला याद रह जाए तो ठीक है, नहीं याद रहे तो सिंपल इतना याद रख लेना कि अरेंजिंग इन द असेंडिंग एंड द डिसेंडिंग ऑर्डर, and if it is a odd number value directly take the middle value, and if it is a even number value you have to take an average of middle 2 to get your median. Most commonly occurring value it is your mode. ठीक है, mode में 2-3 points. Number 1, if single value is having a higher frequency, that is a mode, but अगर there is a tie between the two or more frequencies, then you have to choose the mode in a two-way. Either you can be taking the average of those frequencies or those numbers, or you can be having the actual value. ठीक है, which is preferred? It is actual value is preferred. So mode is what? It is the most commonly occurring value. Agar if two values are having the same frequency, then either you are taking an average of that or you are writing the actual value. The multimodal is the actual value is preferred, and that's why another question, that which is a central tendency parameter which is having value more than one possible is mode. Outliers are the extreme values in the given data, and यहाँ पे भी 2-3 क्वेश्चन पूछे गए हैं. Number 1, that most affected parameter in the presence of outlier will be the average or the mean value. The least affected is the mode value, but preferred is the median. Now, what type of the data, if it is given, then which central tendency parameter you will be preferring? This is another question. Means suppose if you had a height is given to you, then you want to know the mean height. Now, if different groups of the students are there, like this is a student from Russia, this is a student from China, this is the students from Ukraine, then you will be going that which group is having the more number of the students. If you are arranging the value as per the name, then we are choosing the mode. Okay. Now, if you are arranging the value in the order, like what is the pain scale में, that is 0 है, 1 है, 2, 3, 4, 5, 6, 7, 8, 9, 10. So if you are arranging the value as per the order, we are choosing the central value as the median. ठीक है, so 3 type के data हैं and 3 central tendency parameter है. So if the metric data is given where measurement is possible, we are using the mean as a central tendency. If it is a ordinal data arranging in the order, then median will be taken as a central tendency parameter. But if it is a nominal data, then we will be taking the mode as central tendency parameter. Then, so these are about the central tendency. Now, coming to the dispersion. Dispersion mein, the number one is the range. Value between the two extreme ends is called as the range. The normal distribution is also called as a Gaussian curve. Then relationship in the normal distribution pattern, mean is equal to median and mode. Plus minus of the one standard deviation covers the 68 or 68.3%. Plus minus of the 2 covers 95 or 95.4. Plus minus 3 is 99 or 99.7. Okay? But always this relationship is not like this as a normal. If it is a right skewed, means a long tail of this is going towards your right side. In that case, the mean is more than the median than the mode. And if it is towards the left side, then it is the left skewed or negative skewed. It is the mean is less than the median and mode. And if you can remember, in the yesterday mock, I had given you one question, and that question was I had given you some values and asked you that what is a deviation or the skewed, or identify whether it's a normal deviation or the positive skewed or negative skewed. Okay? So by looking at the values you cannot say. So in that you have to calculate the mean, median and the mode, and then you have to see the relationship which one is higher. If all are equal, it is a normal pattern. If a mean is higher followed by than the median than the mode, it is a positive skewed. If a mode is highest followed by the median than the mean, then it is a negative skewed. So this type of the question will take a little bit of more time. So no formula is there. So you have to first calculate all the three central tendency parameters and then you have to comment. And based on this, they ask a numerical. Either they will be giving you the range, ask a standard deviation. They give you the standard deviation, they can ask you the range. They can be giving you the range, they can ask how much of the percentage of the population is being covered. So any mix and match question they can be asking. Now, root mean square deviation is the standard deviation. We should be knowing the formula, that is a square root of sum of deviation square. Okay? X minus x bar deviation square divided by n. Okay? And we should be knowing that how to open this formula. Normally they don't ask us to calculate the standard deviation. So first step mein you have to do the calculation of the average or the mean. Second is actual value जो individual value है, individual value का you have to make a deviation from the mean value, each value का. Then you have to square the each value. Then you have to add up this square deviation, and then you have to divide by the number of the values and then take the square root. This is how we are calculating the standard deviation. Now, what is a relative deviate? Individual value ka if we try to find the deviation from the mean value, so deviation of a single value from the mean in terms of the standard deviation is called as a Z score or relative deviate. And if you remember, we discussed in the statistic that any value within a plus minus of the two standard deviation is normal. Like we discussed in a growth charts, the baby weight till -2 is normal. Okay. So if a Z score is up till plus minus 2, either towards the higher side or the lower side, it is normal. If it is beyond that, it is considered as abnormal. Now, difference in the sample value and the actual value, it is called as a standard error, and it is calculated as standard deviation divided by square root of the sample size. So, it depends upon the sample size. Agar bigger sample size hai, तो standard error will be reduced. Then we can make some errors. Before start the study, we make a null hypothesis, means there is no relationship between the two components. Reality mein, if it is true, so your study should also say that there is no relationship, and you have to accept that null hypothesis. But in reality, it is true, null hypothesis, there is no connection. But your study says no, there is a connection, and you reject that null hypothesis. So, true thing you are rejecting. So, true thing if you are rejecting is type 1 error. False thing if you are accepting. False matlab, in reality, null hypothesis is false, means null hypothesis says no connection between the smoking and lung cancer, but reality mein there is connection. So, reality mein null hypothesis false है, लेकिन आपकी study says कि there is no connection, तो false thing को आप accept कर रहे हैं. Ideally तो your study says no, there is connection and you should be rejecting the false thing. But false thing को अगर आप accept कर रहे हैं, so it is your type 2 error. So remember, the parents' advice you are rejecting, true thing you are rejecting is type 1. Your friend's advice, false thing you are accepting, it is type 2 error. Most dangerous is type 1. P-value is type 1 error, beta value type 2, maximum upper limit of p-value, that is type 1 error, is 5%. So my p-value for a good result should be less than 5%. And this is the question, that significance कब होगा, when the p-value it is less than 0.05 or error is less than 5%. If your error is less than 1%, very high significance of your study, because p-value is very low, your error is very low. Then when we collect the data and do the calculation, we have to use certain test. So here the question is asked is which test you will be using. To solve these type of the questions, you have to first see what type of the data they are talking about, qualitative or quantitative. Second is two groups they are comparing or more than two groups they are comparing. Third is the two groups अगर compare कर रहे हैं, it is a one group which is before giving any drug parameters are taken and after giving the drug parameters are taken. So same group before and after intervention. So if we are comparing the quantitative variable, we will be using the parametric test. How you can be knowing that it is a quantitative variable? Either they are giving a mean value, or they are giving a standard deviation, or they are talking about the metric data, then it is a quantitative variable. Quantitative variable में if you are comparing the two groups, it is a student t test we are using. अगर more than two groups हैं तो ANOVA test we are using. Two groups में भी अगर same test before and after intervention, same group before and after intervention we are comparing, then it is the pair t test. अगर two different groups we are comparing, it is unpaired t test. ठीक है? Then qualitative variable, if you are comparing, the non-parametric test we will be using. It means either they are talking about the percentage, proportion, or nominal data or the ordinal data. If two same groups we are comparing, we will use the sign test, or if two different or more than two groups we are comparing, we are using chi-square test. So remember the name of the test, and these are different examples, and you have to find out which test we will be using. Then distribution of the data, if you are dividing the data in 100 equal parts by 99 cuts, it is a centile, and centile means जो cut है, how many percentage of the values are below that point. Like this is a 95th percentile, means 95% of the population or values are below this point, ठीक है, and only 5% are above this point. Now quartile means 4 equal parts by the 3 sections. Now first quartile 25% is below that, second quartile 50% is below that, third quartile 75% is below that. Now यहाँ पे sometimes the one question is asked is what is interquartile range. Interquartile means the percentage of the value between the first quartile and the third quartile. This is called as the interquartile range. Interquartile range. Okay. So interquartile range is between first quartile to third quartile, and it is covering 50% of the value. Okay. So interquartile range is between first quartile to the third quartile, or interquartile range or interquartile distances. It is between first quartile to the third quartile, and it is covering 50% of the population, or 50% of the values. 50% of the values or 50% of the population is between the interquartile distance or interquartile range. Okay. Then sampling, what are the random, what are the non-random? Random are stratified random, systematic random, simple random, and the cluster random. What are non-random? Voluntary, quota, snowball, or convenience. The first question, which is better? The random is better than non-random. Okay, random may be number one is stratified random, then it is systematic random and the simple random. Stratified means we are dividing them into the different groups as per the features, and from each group we are taking the some random sample, some randomly some values we are taking. Okay, so first is based on the features, and then in each group by simple random sampling we are selecting few values. Systematic random means first we will be selecting one random number and the sample interval we have to choose, and then that every 10th number or 5th number or 6th number we have to select like this. Okay, like every 10th number we have to select. So first I have taken a 5th value, so 15th, 25th, 35th, like this. Simple random is like a lottery. Every person is having the equal chance to come into the study. Cluster sampling, it is used for immunization survey. It is also known as 13:7 cluster, जहाँ पे 30 groups हैं and हर group में 7 children हैं. So this is all about our this topic as statistic. Our next topic is environment. In the environment, the 4 sections are very important: water, air, insects and the waste disposal. Mainly the questions are asked from these 4 areas. Water may, if I talk about, the most important WHO criteria for the drinking water is should be free from pathogenic organism, that is E. coli. Other qualities, if you can remember, will be okay. The chloride content should be less than 200 milligram. TDS of water should be less than 500 milligram per liter. Nitrate should be less than 45 milligram and nitrite should be less than 3 milligram per liter. Then there should be some salts are present in water which is causing the hardness. If it is the bicarbonate salts, it is causing temporary hardness of calcium or magnesium. If it is chloride, nitrate or sulfates, it is causing the permanent hardness. We measure the salt content, and if you are measuring in the milligram per liter or milliequivalent per liter, 1 milliequivalent per liter is equal to 50 milligram per liter. If it is less than 50 milligram per liter, it is soft. 50 to 150 milligram per liter, it is moderately hard. 150 to 300, it is hard, and more than 300, it is very hard. But the important question when we require the softening of the water is if it is hardness level is more than 150 milligram per liter or more than 3 milliequivalent per liter. When we have to do the purification, first we store the water in big tanks, and with gravity the particles they settle down. Then we pass through the filters, slow and the rapid sand filter. The question is both of them having a meter that is called as venturiometer, and this is measuring the blockage in the filter that is called as the resistance of head of the filter. A biological layer of the plants, that is humus duct layer, is only present in the slow filter, which is killing the organisms. So water quality is better in the slow sand filter in comparison to the rapid sand filter. What is the sand particle size? It is 0.2 to 0.3 mm in slow sand filter, while it is the 0.4 to 0.7 mm in a rapid sand filter. Now cleaning of these rapid sand filter is by backwashing. So the experts or highly skilled person are required, but slow sand filter mein manual scrapping is done. So the less skilled person can also do the manual scrapping. Most important is disinfection. This is to kill the pathogenic organisms. the most commonly we are using the chlorine content and the chlorine gas, tablet or bleaching powder. And उसमें once we add in the water, the most important disinfecting agent is hypochlorous acid. Others could be hypochlorite ion also. How much of chlorine will be required to kill the pathogenic organism is the chlorine demand. It is detected by Horrocks apparatus. So, we take a fixed amount of water and we make a paste of bleaching powder. We add up in the increasing doses of bleaching powder in each jar. 6 jars are there. This is Horrocks apparatus. When all the organisms are destroyed, the free chlorine will appear, which is combined with the indicator, that is starch iodide, and will give this purplish blue color. So, first cup which is showing this color change will be noting that number. From that number onwards, all other cups will also show. Okay? So, suppose like second cup onwards the color is seen. So, 2 into 2, that is n into 2 is the 4 gram of bleaching powder will be required to disinfect the 455 liters of water. This is a fixed value. Okay? So, another twisted question that if I say that in a water sample the first cup is showing the color change and another sample the fifth cup is showing a color change, which cup is having the high organism. So, जिसमें first cup में show हुआ उसमें how much of a chlorine will be requiring, only the 2 gram of the bleaching powder will be required. It means a less organism is there. लेकिन अगर fifth cup onwards color shows, so 10 gram of bleaching powder will be required, it is having a higher amount of organisms. ठीक है. So, जितना जल्दी वाला का नंबर कप आएगा उतना कम बैक्टीरिया है, जितना देर से कलर आएगा उतनी ज़्यादा बैक्टीरिया है. Earlier the color will appear, it is having a lesser bacteria, the later the color will appear, it is having a high bacteria. ठीक है. So, instrument Horrocks apparatus, its image, indicator is the starch iodide, and amount of the bleaching powder is n into 2 in grams, that is n is the first number of the cup showing the color change, and it is for 455 liters of water. Okay? Now, when all the organisms are killed, the extra chlorine it starts appearing in water. That point is called as break point, and this free residual chlorine, the level is fixed. We have to remember the normal drinking water it is 0.5 ppm after contact of 1 hour at the pH 7. Disaster में 0.7 or more, swimming pool में 1 or more is there, and it is measured with this instrument that is called as chloroscope. If a given sample is given of water, if we try to find out how much is the free chlorine, how much is the total chlorine and the combined chlorine. So, 2 tests we are doing, orthotoluidine and orthotoluidine arsenide test. First question, which is better? It is orthotoluidine arsenide test is preferred. It is better than orthotoluidine test. Okay? So, orthotoluidine arsenide test is better than the orthotoluidine because it tells us the free and combined separately, and there is no effect on the result if there is a presence of the salt like iron or manganese are there. लेकिन orthotoluidine test में if these minerals are present, then the result will be affected, and initially it will be showing color change within 5 to 10 seconds. That is giving the free chlorine. लेकिन अगर आप 5-10 seconds में color नहीं change note कर पाए, then after 20 minutes you'll be getting a total chlorine. So, to combined chlorine you will not be getting directly, but orthotoluidine arsenide में combined chlorine you are getting directly. ठीक है? So, these are the advantages of orthotoluidine arsenide test. Now, the first question, which is the most important bacteriological indicator of water contamination, it is E. coli, which is an indicator of the non-fecal contamination, Klebsiella, which is an indicator of the past contamination, Clostridium perfringens. Okay? So, these are some of the questions of water. Now, insects में you should be able to identify the insect images and tell the disease. So, these 3 mosquitoes are very important. If they are sitting with an angle to the surface, it is A, and Anopheles is angle. Okay, but if they are sitting parallel to the surface with the dots present in the body, ADs, D for the dots, it is ADs. If they are parallel to the surface with the hunchback appearance and no dots, it is your Culex mosquitoes. Okay? And Mansonian sitting with the parallel to the surface but not very commonly asked in the exam. Another very important insect is a fly, and fly में there is a long antenna and the oval shaped wings are there with the cilia. So this is your sand fly. Okay. Now the diseases caused by Anopheles, alphabet A, one disease malaria, Culex alphabet C, third alphabet 3 disease, filariasis J and West Nile fever, Aedes D, fourth alphabet 4 diseases, yellow fever, dengue, chikungunya and Zika virus disease. ठीक है. Mansonian is also causing filariasis, but अगर filariasis का main vector is asked is the Culex mosquito. Sandfly is again very important. Leishmaniasis is a group of the disease. Visceral leishmaniasis, kala azar. Cutaneous leishmaniasis, oriental sore. Sandfly fever, mucocutaneous is oriental sore. Visceral is kala azar. Sandfly fever and Oraya fever, and Chandipura virus encephalitis. So COSO C, it is the diseases caused by sandfly. Then we should be knowing the 3 typhus fever, epidemic typhus by louse, endemic typhus by flea and scrub typhus by mite. Another very important disease for that vector is asked is Q fever. The first answer should be no vector, or it is through the respiratory route aerosol. If it is not there, then it is can be by soft tick also. Another very important is the Casanur forest disease. In India, it is by the hard tick. Outside India, it is by soft tick. Okay? So soft tick is outside India, but inside India, it is by hard tick. So these are certain diseases caused by vectors. Then we should be knowing some important qualities of mosquitoes because they help in their control. Anopheles, they are breeding in fresh water. Aedes, they breed in artificial water collection. So if we have to control Aedes, avoid artificial water collection. Mansonian, they breed with the water with the plants. So if the plants are present, so manually if you can pluck out all the plants, Mansonian will not grow. Next is identification, we had already talked about. The Aedes का body पे white spots हैं, Anopheles के wings पे white spots हैं. Larvas are very important. Anopheles का larva opposite to the adult sits parallel to the surface. So to kill the larva, we have to put the chemical which is not dissolving in water, and this is what is Paris green or oil we can be putting. But Culex Aedes and Mansonian larva, they are suspended to the surface, like adult is parallel, so they are suspended. So in that case, you have to put the chemical which is dissolving in water, otherwise they will not be killed. So we are using the abate or tamifos. Okay. So how we can have a larva mosquito control? Either you can be doing in larva control, not allowing the mosquito to breed or convert into the adult mosquitoes of these eggs. This is preferred in the urban areas and it is the best method, primordial level. But suppose if you are not able to control the growth of the appearance of the new mosquitoes, so you have to do the insecticidal spray to reduce the concentration, adult control, and it is a primary level prevention and it is preferred in the rural areas because farming hai, water collection, we cannot avoid the breeding. Okay, so we are reducing the mosquito population. Now primordial level may avoid the breeding by avoiding the artificial water in Aedes, putting the chemical as Paris green for Anopheles, tamifos or abate for rest of the larvas, Gambusia fishes for all the type of larvas, mechanically plucking all vegetation or the plants there. Insecticidal agents may DDT residual every 6 months, Malathion residual every 3 month spray. Its spray technique is ultra low volume spray. Natural pyrethrum non-residual. Spray technique is space spray. Then we are having the insecticide treated mosquito nets also. So these are some of the important points about insects. Now, if we talk about air, most important air pollutant carbon monoxide. Best indicator of the air pollution is sulfur dioxide. Carter thermometer is used to measure now the low air velocity, earlier was for cooling power. Sling psychrometer for humidity, globe thermometer for radiant temperature. Upper limit of Mercadal index is 4.5 liter. Greenhouse gases, the most important greenhouse content is carbon dioxide. Others could be the methane, nitrous oxide, CFC compounds. Time to time, the agreements to control the greenhouse gas effects. Kyoto Protocol was in Kyoto city of Japan to control of this greenhouse gas effects. Paris Agreement benchmark decision to keep the rise in global temperature less than 2 degrees centigrade, preferably up to 1.5 degree. Soiling index is the air pollution, not the soil. AQI is again a burning topic because Delhi is now a gas chamber. What we say, it's a very high air quality index. So I am expecting a question from AQI. So try to remember the 8 components of the AQI, that is PM2.5, PM10. Most common air pollutant, carbon monoxide. Best indicator of the air pollution, sulfur dioxide. Greenhouse gases, methane, ozone, nitrogen dioxide and lead. So these are the 8 components. Till 100, it's okay. Best is green zone till 50, yellow zone till 100. Uske baad till 150, a healthy person can accept, but allergic patient will be risky or in zone. And beyond the 150, it is unhealthy. So unhealthy till 200, then very unhealthy 200 to 300, and 300 plus is hazardous. So remember this AQI scale. Then coming to about the waste disposal. The most sanitary method for refuse disposal is sanitary landfilling or the controlled tipping, and 1 acre land is required to dispose the waste generated by 10,000 people per year. The method of the waste disposal in the small camps is burial. So most sanitary is your sanitary landfilling or controlled tipping. Then fecal waste agar hai liquid fecal content is present in the liquid waste, that is called as a sewage. The strength of the sewage means how much is the fecal matter is present is best calculated by biochemical oxygen demand. In the septic tanks, it is by anaerobic oxidation where it stays inside for 24 hours. No oxygen is there inside the septic tank. In the sewage treatment plant, in the secondary treatment, that is actually the treatment of the sewage, it is by the 2 methods, either the trickling filter method or activated sludge process. Activated sludge process is preferred. It is the aerobic oxidation and it happens in the chamber, that is aeration tank. It is heart of the sewage treatment plants. In the ponds, as a small ponds sometimes used to treat the fecal matter. Daytime में aerobic है, night में anaerobic oxidation है. So this is all about a topic of environment. International health में, now the short topics we are coming with. Quarantine means separation of healthy exposed. Isolation means separation of the deceased person. How long in the quarantine? Till the maximum incubation period of the disease. How long in the isolation? Till period of communicability. Okay? Quarantine period for yellow fever, which we follow in India, is 6 days. Validity of the yellow fever certificate starts 10 days after the vaccination and it is lasting lifelong. Simultaneously, you have to control the mosquito breeding by avoiding artificial water up to 400-meter radius area, because Aedes can fly up to 100 meters. Regular survey of the houses to look for these breeding sites in the houses, and keeping the two indexes at a point. Like Brutia index is पॉजिटिव ब्रीडिंग साइट्स डिवाइडेड बाय हाउसेस एग्जामिन्ड. एक हाउस में अगर 10 ब्रीडिंग साइट्स हैं तो 10 विल बी काउंटेड. ठीक है. सो बी फॉर ब्रूटिया, बी फॉर द ब्रीडिंग साइट्स. Aedes aegypti index is positive house for the breeding divided by houses examined. Like one house positive, maybe the 200 sites are there, but one house is positive. So Aedes aegypti index should be kept at less than 1% and the Brutia index should be less as 5%. Bioterrorism, we should be knowing which agents are included in which category. Most commonly used category A agent is anthrax, second most is plague, others are botulism and smallpox. Category B are the typhus fever, epidemic typhus, Q fever, brucellosis. Then category C is new upcoming agents like Nipah, Hanta and the coronavirus. Within 24 hours, we have to inform to WHO about the 3 diseases which are coming under international health regulation. So sometimes they are asking as an IHR, so don't confuse. IHR is international health regulation. So within 24 hours, we have to inform to WHO 3 diseases. We can remember when you will come to Delhi to collect your certificates, you will go to Connaught Place because it's a very common hangout place. So would you love to go to Connaught Place in Delhi? Yes. So cholera, plague and yellow fever. International agencies, their head office, their logo and important function. WHO head office is in Geneva. And the theme is for 2025 is healthy beginning, hopeful future, and this is logo. UNICEF logo head office is in New York, and for the children, so go by activities for the children, growth monitoring, ORS, breastfeeding, immunization. 3F is for female. Food and Agriculture Organization, it is head office is in Rome, taking care of the availability of the food to each one. International Labour Organization is in head office is in Geneva, taking care of labor population. Then important is the DANIDA, USAID. Now it has been stopped functioning because funding is stopped by the US government. DANIDA, Danish International Agencies, it is funding for blindness control in India. SIDA, Swedish International Agency, it is funding for tuberculosis. S for SARS. UNFPA, United Nations Fund for Population Activity, it is funding for reproductive health. All 3 had been asked in a question. Then Rockefeller Foundation, it is funding for the medical education like building the libraries or institutions. Ford Foundation, it is funding for building the sanitary toilets in the rural areas. Sanitary toilets in the rural areas, it was also one of the PYQ. CARE Foundation, it is now supporting for food in the ICDS centers, although it was planned for the war victims, but when no war, then it is now funding for food in ICDS program. International Red Cross, again it is for war victims, but non-war situation it is helping in disasters. So these are some of the international agencies and these are the logos and head office at one place. Geneva में we had a head office of WHO, UNAIDS, International Red Cross and ILO. UNICEF, UNDP and UNFPA, it is in New York. SIDA, Swedish agency, the capital of Sweden, Stockholm. DANIDA, Danish International Agency, the capital of Denmark, Copenhagen. And Food and Agriculture Organization, it is in Rome. So these are the head offices. Disaster mein we should be knowing the disaster cycle. Arrange the phases in the disaster cycle. Post disaster, once the impact happens, response, rehabilitation and reconstruction. Post disaster. Before the disaster, mitigation and preparedness. Now few questions. The response में first aid and triage and tagging. First aided by the co-passengers and the local people. and triage and tagging is by the National Disaster Relief Force team and DRF team members. Mitigation means to find the cause of the disaster and will take the necessary actions to avoid problems in a future. Like suppose in area there the more of the earthquake is there, so old buildings will be removing. So changing the building codes, they should be earthquake resistant buildings will be preparing. If there is a more of rain in that area, so we are trying to put the lightning indicator on these buildings, so it will not be affected by lightning. So this is to find the cause of the disaster and take a necessary actions to avoid the problem in future is mitigation. Preparedness means increasing the surge capacity of the hospital. And what is the surge capacity is to deal with the emergency, like their emergency response facilities we have to improve. Which ministry is controlling? It is Home Ministry of Home Affairs, but the local level pe the decision is taken by district magistrate or collector or head of the district. Okay? Now, triage and tagging is very important. Triage means segregation of the patient, not based on their severity of the illness, based on their survival. Okay, this was also one of the PYQ, not based on the severity, but based on the survival. The next is how many groups. This is very, very important and many repeated questions are asked. First is arrange from high to low risk or low to high risk. See the question carefully. Red means within 6 hours we have to do the life-saving surgery. Yellow means we can be doing observation or surgery within next 24 hours, 6 to 24 hours. They can wait for some time, like fracture है, थोड़ा wait कर सकता है plaster लगाने के लिए. लेकिन bleeding है, so we cannot allow them to wait, otherwise he will die. Green means low priority, means they are the ambulatory patients है, minor injuries है, and black में या तो already dead patients है या who are about to die, moribund means about to die. So they are included in black category. Okay. The most common disease is gastroenteritis, and to avoid that we have to do, or we have to provide the safe drinking water. Now we cannot just build the purification plant in minutes. So we are just doing the chlorination. So we collect water in big tanks, put the bleaching powder or the chlorine tablets. So the safe drinking water supply by chlorination, and keeping the free residual chlorine little bit high of 0.7 ppm or more. As there is the disease in cholera, typhoid in disaster, but we cannot give the vaccine in post disaster, although they are vaccine preventable, but their seroconversion time is more than the incubation period. This we had already discussed. So incubation period is short, so definitely the disease will appear earlier, even there is no response of the vaccine. So no role of the vaccine in post disaster phases, but yes, agar traumatic injury hai, so we can give the tetanus, and overcrowding agar hai relief camp mein, and more children of a less than 5 year, so within 3 days of exposure we can give measles vaccine. Biomedical waste mein we should be knowing that which waste is going in which category and what is the disposal. Yellow में non recyclable infectious waste it is going, like placenta है, gauze pieces, cotton, bandage, animal anatomical waste, microbiological waste or liquid or solid chemical waste है, empty blood bag, very important. Now अगर cytotoxic waste है, now just listen carefully, cytotoxic अगर waste है, any drug which is expired or not used, vial or syringe filled with the drug, like if you are giving the drug, half allergy happens, half drug is present in the syringe or the vial, even empty vial after giving the drug, because some amount of the drug is left inside the vial also. So that will also go into the yellow category. Okay? So empty vial now it is included. So say empty vial even after giving the cytotoxic waste. If they say the empty vial of any antibiotic, no, it will not go. But अगर anti-cancerous medicines दिया है आपने या any of a cytotoxic drug दिया है, उसका empty vial भी will go into yellow category. Now red में it is an infectious plastic recyclable waste. Gloves में they will confuse you with the blood stain, non-blood stain. Every glove will go into red only. ठीक है? Plastic items whatever we are using in hospitals, syringe without the needle. ठीक है? और अगर detachable needle है, so we have to detach the needle and only the syringe will go into red. ठीक है? But अगर fixed needle है, तो it will be going into white category. Blue में क्या है? Puncture proof cardboard containers है. And we are having the glass items broken or discarded or any removed metallic body implants. White में puncture proof translucent boxes है and needle fixed needle with a syringe और separate detachable needle है, blade है, knife है, all go into white. और जो black category है वो जो non infectious waste है like food peels है, paper है और wrappers of all these gloves है, syringes है, it will go into black. Now yellow content is by incineration. No pre-treatment or disinfection except for the two waste, microbiological and the liquid waste. Liquid chemical ka although in the yellow category but don't transfer into in the yellow non-chlorinated bags. And we do the disinfection and directly discard into the domestic drain. For red, white and blue, the first step is disinfection. Then we will be breaking into the smaller pieces, shredding and then finally doing the disposal. Red ka it is converting into coal tar material and white and blue it is recycling, sent back to factories. If we have to do the landfilling, we do the secure means it will not come in contact of underground water by inertization or encapsulation. ठीक है? And screw feeder it is used for sharp infectious waste. So this is all about our this topic of biomedical waste disposal. Now occupational health में Factory Act guideline says that space per worker should be equal or more than 500 cubic feet, but height of the wall should be taken up to 14 feet height only, not beyond that. Less than 14 year is not allowed. ESI Act says it is working under all the industries except defense, railway and mining. Employee has to contribute in that is 0.75%, employer 3.25%, remaining 96% is by the government. 1:7 ratio of state and central means 12% by the state government, 84% by central government. Only for the workers having income of less than 21,000 rupees per month. How much duration of the leaves are important with how much of salary? 3-month leave with 70% as sick leave, 2-year leave with 80% salary as extended sick leave, 100% salary with 6-month leave as maternity, 6 weeks as abortion. If she delivers less than 28 weeks gestation, she will be considered as abortion. Any pregnancy related complication, 4 weeks leave other than the maternity leave or abortion leave. Tubectomy after that 2 weeks and vasectomy after that 1 week leave. Temporary disability है तो till recovery leave with 90% salary. Permanent disability है तो pension will be started. If services through the direct ESI doctors, it is a direct benefit. If it is through the locally registered medical practitioners, it is indirect medical benefits. For the pneumoconiosis, the particle size should be 0.5 to 3 micron, which is reaching into the lungs and alveoli. Most common pneumoconiosis is silicosis, which is commonly seen with the workers of mining industry or the stone cutting industry, and silicotic patients are prone for tuberculosis. Only pneumoconiosis which is causing lung malignancy is asbestosis. Most common cancer is carcinoma bronchus, but is specific is mesothelioma of pleura. It is commonly seen in the workers of shipyard industries or fireproof glass industries. Coal industry में the coal dust is causing anthracosis, and even if you remove the patient, it is leading to progressive massive fibrosis. Progressive massive fibrosis. even after removing the patient from atmosphere. Related to sugarcane dust or sugarcane fibers, bagasosis, and the fungus is growing on that, and that is thermoactinomycosis saccharii, and it can be prevented by 2% propionic acid. So, no compensation is given to worker. With the cotton dust, bacinosis, more commonly in the spinners. Because of the grain husk, farmer's lung, again with the fungus Mycopolyspora fani, but remember the fungus of bagasosis. Most common occupational cancer is skin. It is about 3/4 of all occupational cancer, and the pneumoconiosis causing the cancer is asbestosis. Lead can be entering in the body either through inhalation, that is the most common route, or maybe through ingestion of food, water, or child is eating a paint chips. To cause the less pyogenic symptoms, the serum lead concentration should be equal or more than 70 microgram per deciliter. But before that, we are doing a screening test in urine, either detecting the coproporphyrin level or aminolevulanic acid. Preferred is aminolevulanic acid in urine, not in the blood. Inorganic features causing the peripheral symptoms: Bartonian line, blue line in the gums, basophilic stippling of the RBCs, stippling dots inside the RBCs, not in the basophils, and organic compounds leading to central nervous system findings. Change in the bedsheet daily as per the 7 colors of the Indradhanush to maintain hygiene. This is called as Abhiyan Indradhanush. No confusion with the mission Indradhanush. It is related to, vaccination. If we talk about the social mental health, now these 3 topics which we will be talking now, social and mental health, health planning and management, and health education. Now questions are more coming from these topics, so give the thorough reading for these topics. Okay? BPL criteria: if a caloric affordability is less than 2400 calories per day per person in rural areas and less than 2100 in the urban areas, these are the BPL families. Okay, and total BPL families on record, it is around 28 to 29%. Okay, why I'm saying on record? Because some by a wrong channel they got their BPL card made and they are getting the facilities. Now scale is very important. The socio-economic status classification scale used in urban area, it is modified Kupuswamy scale. The component are education of head of the family, occupation of the head of the family, and income per capita, and different scores are given. Try to remember these scores. Okay? Husband, wife with the children, single couple with their children is nuclear family. More than one couple with their children is joint family, common business, common income, common kitchen. Family cycle, again repeatedly question is asked is. Now don't confuse. This is actually a duration. Now from the marriage, before the first child is born, that is formation. Once the child is born, it is an extension. Till before the last child is born, it is an extension. Once the last child is born, it is complete extension till before the birth of before the first child leaves the home. Because when the first child leaves the home is retraction. Before the last child leaves is the retraction phase. Now once the last child leaves is complete retraction. Before the spouse dies. Once the spouse dies, it is dissolution. Before the survivor dies. Once the survivor dies, it is extinction of the family. Okay? So, in one question they asked, arrange the family cycle in order. Another question they had asked is, what is the time interval from the birth of the first baby before the birth of the last baby is an extension, or birth of the last child before the first child leaves is a complete extension, like this. Mixing of the culture by education or marriage, it is acculturation. If we are improving our knowledge, it is cognitive learning, CK brand of clothes. If you are changing our attitude, it is affective learning, A square. If you are learning skill, it is the psychomotor. Okay. Then crowd, mob and herd. Group of people for the same reason without any leader, like going to watch a drama, watch a movie, watch a cricket match, it is crowd. The mob means a group of people controlled by a leader to do the activity which leader says. Psychologically or emotionally they are controlling, it is the mob. जाके पत्थर फेंक के आ जाओ वहाँ पे, जाके उसको मार के आ जाओ, ठीक है. So this is mob. Herd means a group which is controlled by the leader, but they don't do this emotionally, they don't control. It is for the better thing, okay. Like a tourist guide, it is guiding the individuals. Then relationship of the social factors to the disease is social pathology. Normally, WHO says that 5% of the GDP should be invested on health sector. But currently, India ka it is the 2.5% of the GDP on the health sector, and we are planning to go up to 3%, but WHO says go up to 5%. Then next topic is health education. Whatever the methods or the facilities we are having, we are spreading its information to the community. If it is a one-way communication, it is called as didactic. Message is going on, no feedback. But if you had an interaction with the community, get the feedback, it is a two-way or Socratic. So a question is asked, all are one way, all are two way. Don't confuse didactic as a two-way. It is a dictator, one way. Which is the best method, one-to-one group or the mass? The best is one-to-one individual, but cost effective is mass method of communication. India mein the most commonly used method for mass communication is television. The world mein it's an internet. Socratic methods are important and questions are commonly asked from this. The four are important: focal group discussion, demonstration, panel discussion and clinical symposium. Focal group discussion, the 6 to 12 members are discussing. Their interaction is graphically recorded. It is called as sociogram. It is to change the mindset of a person or to change the health attitude and behavior. Here the open questions are asked, means you ask a one situation and they are supposed to answer that problem or solution for that. Not only the yes and no. अगर yes and no होगा तो close ended questions है. Open ended means long answers are to be given. Demonstration में हमें show करके बताना है. We have to show them how to perform, like ORS preparation, the wound cleaning after the dog bite, BP monitoring, any of our investigation. If 4 to 8 speakers that delivering a talk one after another, a set speech, a fixed topic, fixed time is given, and another speaker is not interacting during the speech. Audience is also not interacting during the speech. It is clinical symposium. But if a moderator with the experts in that field and they are interacting among themselves also, interacting with the moderator, no fixed topic, no fixed direction, no fixed lecture or talk. Audience can also participate simultaneously or in the end. It's a sort of झगड़ा, ठीक है, जो टीवी पे झगड़ा होता है ना, टीवी शोज पे 6 to 8 के बीच में, वो पैनल डिस्कशन है, ठीक है. So this is panel discussion. So question is asked that they will give you a scenario or they will say all other features of panel discussion except, all other features of clinical symposium except. One more question was asked is Delphi method. It is actually, you can say, the Zoom meeting sort of thing, that experts are at a different places and they interact and form a final decision. So this is the Delphi method is actually a group method. Now counseling mein we have to remember the method of counseling. For contraception mein the couple counseling is done. It is called as a gather approach of counseling. Family mein when you have to break a bad news of the cancer, about the cancer prognosis to the family, we are using a spike approach, and individual one-to-one it is in STDs. Now, barriers of communication, if you are telling to somebody not able to understand, other difficulty in the hearing, that is physiological. The sound is not going, the environmental noise is there, mic is not working, it is environmental. Patient is mentally retarded और इमोशनली डिस्टर्ब, कुछ सोच रहा है, इट इज साइकोलॉजिकल. सुन रहा है, समझ रहा है, फिर भी नहीं कर रहा क्योंकि रिलीजन नहीं कहता या कोई उसका बिलीफ है. सो कल्चरल मीन्स देयर ही इज एबल टू अंडरस्टैंड एवरीथिंग, ही इज लिसनिंग ऑल्सो बट इज स्टिल नॉट डूइंग and not following because of their beliefs, their customs, their illiteracy. They are not understanding the importance of that thing. And the language barrier is there, like if south mein you are going lecture in Hindi, or in north the people, a person coming from the south is speaking in Malayali, so there's a language variation is there. So cultural language ka there could be the two more words we are using. One is a linguistic barrier. Linguistic means difference in the language. Another is a semantic barrier. Semantic barrier means they say the difference in the meaning of the same words. ठीक है, सेम वर्ड का there is a different meaning. Suppose पंजाब में बड़ा common word use करते हैं मिट्टी पा, ठीक है, मिट्टी पा means whatever has been done, उसको भूल जा, ठीक है. और दूसरे ने समझ लिया, उसने कहा कि भाई मिट्टी पा, मिट्टी डालनी है, तो उसने उठा के मिट्टी डाल दी उसके ऊपर, ठीक है. तो डिफरेंट मीनिंग ऑफ द सेम वर्ड्स. तो this is what is semantic barrier. Okay, how we can educate? Either by motivating them, it is a health education approach. By putting the danda or some fine, it is a regulatory approach or law. By giving the free samples of free services, it is a service approach. Okay, or by participation of the local community members as primary healthcare approach. So this is how we can be educating the community. And what is the difference in propaganda and education? Education means when you are listening something, you think and then you react. So you are using your brain and skill and then you are spreading the information. But propaganda mein you are passively spreading the information, like WhatsApp university. You are not thinking twice, whatever the message you are getting, you are forwarding. So knowledge is actively acquired in education. It is passively filled in the mind, spoon-feeded in the propaganda. Propaganda is related to emotions, while education, it is with the reason, you are thinking twice. It is a reflective behavior. Whether you think you have to react or not, it is a reflexive. You don't think. Like suddenly, suppose a hot water falls on my hands, I suddenly remove my hand. Something goes in my eyes, I close my eyes. Without thinking, it is a reflex. So reflexive behavior, it is in the propaganda, and reflective, it is in education. So this is about this topic of health education and communication. The next topic is health planning and management. Now, how we are making the policies at the central level. For all the programs, you have to ultimately make a goal. Goal is an ultimate end point of all the activities. It is not having any time boundation, but you have to complete. Sometimes goals are not achieved, so we can extend our goals. So small activities are objectives. When they are fulfilled, then it is a targets, and then targets are fulfilled leading to goals. Then time to time to identify the problems, we set the certain committees, and experts are included in that committee, and head of the committee, the name of that doctor, person, experts is the name of the committee. So the question is that what are the different committees and their recommendations? Some important committees like Bohr committee, and recommended that the internship in the Department of Community Medicine, that is social physician, primary health care concept or centers concept, PSC concept, and school health concept was given by Bhor committee. Renuka Roy committee says that meal should be given to the school. Mukherjee committee says that separate workers should be for malaria and family planning program. Single worker will not work. Jangalwala committee says that no private practice should be allowed to the doctors working in a government sector. Kartar Singh committee recommended the multi-purpose workers at sub-center and health assistants at the PSC. Srivastava committee says that village health guys should be there in the village. Reorientation of the medical education, continuously upgrading of the doctors about the medical field. If it is patient is not treated at the one center, should be referred to the higher center. Medical officer is at the PSC, so two tier of the health workers between the community and the doctor, that is multi-purpose workers and health assistants, and will be taking the help of semi-professional workers from the community like school teacher or the gram sevak. So these are the recommendations of the Srivastava committee. Then once we launch any program, we have to assess its results, whether it is good or not. So cost benefit analysis, how much money we had invested is compared how much money we are getting in the business. So input and output is compared in terms of money, but medical sector may output is the results, not the money. So it is a cost benefit is the money, but agar effect hota hai, so it is a cost effective. Money input is compared with the results as an output. System analysis means comparison of a old technique with the new one in both money and the results. Network analysis is, it is a graphical plan of all the events leading to the end point. PERT में time range होता है, that within this time you have to complete, like a 2 to 3 months this activity and 1 to 2 months this activity, 3 to 4 months this phase. So time range है, but अगर fixed time है, so that is a critical path method. And in this, the longest path, जो dangerous phase है, that is called as a critical path. If that is delayed, then the whole cycle will be delayed. Like this was an image based question asked is, and they say identify which is the longest path or the critical path here. The critical path is the 10-month duration. This was, that is the equipment order kiya and installment of installation of the equipments. If it is not installed in time, the process will be delayed. Work sampling means how much manpower will be required for the services, like for the doctors, nurses and pharmacists. Now we are making the policies through the Niti Aayog. National Institution for Transforming India, it has replaced Planning Commission. Now we had made the policies through this Niti Aayog. This Niti Aayog was started in 2015 when this BJP government came in 2014. But as we had an existing 5-year policy till March 31st, 2017. So 1st of April say it is started functioning. Okay. And we are making the policies in India through the Niti Aayog. Now, if we talk about the health related policies, globally we are making the policy through the SDG goals. Earlier we were making through the Millennium Development, but now important is the Sustainable Developmental Goals. It is a continuation of the MDG, so it is given by United Nations for 15 years from 2016 till 2030. Total goals are 17, means overall development of the community, but health related goal is only single goal, goal number 3. Only single goal, goal number 3 is health related. What are the targets? Try to remember because important. The global MMR to be less than 70 per 1 lakh live birth by 2030. That is important. This is one of the PYQ. Neonatal mortality rate should be reduced to 12 per 1000 live births by 2030. All are by 2030. Okay? So this is all by 2030 we have to achieve. Under 5 mortality rate should be 25 per 1000 live births. We have to end the epidemic of HIV, TB, malaria and other tropical diseases and universal health coverage. India we are making the policy through the goals through the national health policy. Although the last policy was given in 2017, but later on we had updated the goals. And this is important that we should be knowing that what is our current goal for elimination of the diseases. 2025 is by 2025 tuberculosis, although it is going to be end of the 2025, but till the new updates are coming, the answer for your exam remains the 2025 only. Okay? Then by 2026 measles and rubella, by 2027 filariasis and leprosy free India, by 2027 leishmaniasis, and 2030 is malaria. These are some other goals. Try to remember. TFR was to bring down to 2.1 by 2025, but we had brought to 1.9. Under 5 mortality rate to be brought to 23, but currently it is 29 as per again the SRS report. It is again as SRS September 2025 report. MMR brought to 100 by 2020, but 2025 May it is 88. IMR 28 by 2019, but currently it is 25. Neonatal mortality bring down to 16, but currently it is 19. Okay. Single digit the stillbirth rate, but it is in the double digits, but exit figure is not given as per the latest SRS value. So these are some of the important goals and the targets in India as per national health policy and the global as per sustainable developmental goals.